Okay, so I have a quick question about transplantation, eye transplant, corneal transplant,
Yeah,
and eye donation.
yeah,
How, like, people are not very aware about it, but it's very
yeah.
safe. And corneal transplant is one of the safest procedures ever made, and like it's been done since centuries. Bec-
True.
So, can you just shed some light over that, and
Yeah.
tell our patients and our everyone, our audience, how eye donation is a very good cause, and it helps so many people around the world.
Yes, absolutely. So there has always been a huge deficit between the number of corneas that we need for transplantation and the number of corneas that are available. So it has been helped, awareness has been created thanks to the campaigns where Aishwarya Rai was involved, Amitabh Bachchan was involved. So that has, to an extent, helped to a great extent create awareness. So it's extremely important to, let your eyes be used by somebody after you pass away, because you're eventually like transforming their life, essentially. And a lot of people are worried that will I look disfigured, or it's not like that. So what we usually do when we take eyes from somebody who's passed away and their family wishes to donate eyes, is we place a shell which looks just like a normal eye, and we also close the eye to a certain extent, so the eye doesn't look disfigured for somebody who has donated their eyes and has passed away. uh, and So all of you can find an eye bank near you and pledge your eyes, so you can always inform the eye bank that you would be voluntarily willing to donate your eyes whenever you do pass away, because that's an extremely noble thing that you can do. And in fact, not just the eyes, even other organs, but talking about the eyes, you can pledge your eyes. Every eye bank will have a pledge form, so you can mention your details on that and pass it on to the eye bank, so your name will be in the record. And of course, it's important that even though you have pledged, it's important that family members are aware. So say somebody in your family passes away, you can just call the nearby eye bank. Every locality has a 4-digit number also, so that depends on which area you are in, and that there is a 4-digit number that you can call, which will connect you to the nearest eye bank available. And you just have to inform that this person in my family has passed away and we would like to uh, donate their eyes, and they'll be more than happy to come take the eyes. You'll get a certificate of acknowledgement for your noble gesture, and you'll end up saving somebody's eyes. And corneal transplantation is quite common now. It is something that is done in a lot of patients. There are quite a lot of people who are corneal blind, who have, say, post trauma, had injuries, and they have a white cornea, or who have had infections in the eye. So a lot of those people who are actually blind can have extremely good vision for the rest of their lives, should they get a cornea.
Okay, okay. So, can you tell one more thing? What kind of patients that the transplant, helps? Like, what kind of blindness is cured, and how many
Yeah.
patients of this problem are there in this world?
Yeah, so the only part of the eye that can be used for transplant is the cornea, like I mentioned. And cornea is the outermost layer of the eye, the outermost refractive surface. So somebody, like I said, who has corneal blindness, there are a lot of people who have retinal problems, right? Like nerve issues. Those people cannot be cured by transplants, unfortunately, because science has not reached that level yet. But a lot of people have corneal issues, which is the outermost layer of the eye, and those people can be helped by corneal transplantation. So somebody who has lost their vision because of glaucoma, diabetic retinopathy, or blood vessel occlusions because of blood pressure, like we mentioned, they will not be helped by a transplant. But somebody who has had infections in the eye, or somebody who's born with a defect in both the eyes and the cornea, somebody who had trauma, all of these people can be helped by transplantation.